Testing, 1, 2, 3.
This won't turn on. There we go. Good morning, everyone. I'd like to call our meeting to order. This is the 7th meeting of the Emergency Preparedness and Protective Services Committee. I do want to acknowledge that we gathered today on the unceded, never surrendered ancestral territory of the Algonquin and Anishinaabe First Nations people. We respect and acknowledge their presence on these lands for millennia. Before I read a summary of today's meeting, I would turn to our committee coordinator to take the roll call, please.
Councillor Bradley.
Here.
Councillor Desroches.
Here.
Councillor Dudas.
Here.
Councillor Devine.
Here.
Councillor Hubley. Councillor Johnson.
Here.
Councillor Kelly. Conseillère Plante.
Ici.
Vice Chair Hill. You have a quorum, Mr. Chair.
Excellent. Thank you very much. And we did receive a note from the Vice Chair and Councillor Hubley that they may be late this morning. So hopefully we'll see them in a few minutes. So thanks again, everyone, for joining us today. Je vous remercie de vous rejoindre à nous aujourd'hui. We're sharing our committee date today with Great Shakeout Day, an opportunity to learn and practice how to protect ourselves during an earthquake. I'd like to encourage you to take a moment to practice earthquake drills with your family, friends, and colleagues. Remember to drop or lock, cover, and hold on. This is also a good time to check that your emergency plans and supplies are up to date. Ottawa.ca has information on what to include in your kit, as well as more info on what to do during an earthquake or other emergency. And I remember, just as an aside, my first trip to Mexico City, on the door, when you close the hotel room door, it's all about earthquake, what to do when there's an earthquake. So I thought, hey, They're not kidding around here. So it's very important to know your environment and what to do. Now, today's agenda, item 2 is declarations of interest. Are there any declarations of interest? Seeing none, confirmation of minutes, item 3 from our last meeting, meeting 6, held on the 21st of September, 2023. Has everyone had a chance to review the minutes? And are these minutes carried? Thank you. Item 4, response to inquiries. We have 2 responses before us. First was regarding equity, diversity, inclusion at the Ottawa Fire Services. And the other was from a couple of years ago. First one actually was from Councillor Johnson. The other regarding the Panda game was moved by Councillor Fleury a couple of years ago. Are we lifting this item? There's a plan to lift. Okay. So do I recognize Councillor Johnson? Yeah. Okay. So go ahead, Councillor.
That pursuant to subsection 89.3 of the procedure bylaw, being bylaw number 2022-410, the Emergency Preparedness and Protective Services Committee approved that the rules of procedure be suspended to allow the following item to be lifted onto consideration of the item listed as response to inquiry EPPSC 2023-5 equity, diversity, inclusion at Ottawa Fire Services.
Thank you, Councillor. So this just will allow us to lift this item for further discussion. So is that the will of the committee to allow the councillor to lift this? We can discuss it. Any objections? Does that matter? Carried? Carried. Okay. So we'll just come back to that one in a second. Item 5, minor amendments of various bylaws. I'll just read some information for context. So we have a minor amendment report before us this morning. This is another report being brought forward as part of the overall bylaw review work plan and is timely to bring some bylaws up to date. The report presents minor amendments to update and correct issues of a minor administrative nature in several regulatory bylaws, such as updating key position titles or legislative references. These minor amendments do not require a full bylaw review, have no budget impacts, and do not alter the objective of the bylaw. We do not have a presentation today. There are no speakers, and we have not received any written submissions, but staff are prepared to answer any questions should any member wish to pose a question. Seeing no hands, I'll ask if this matter is carried. Carried, thank you. We'll come back to the other items. We'll go back then to item 4, which is the item that was lifted. Thank you, committee members. Again, with respect to equity, diversity, and inclusion at the Ottawa Fire Services, and I'll turn to Councillor Johnson.
Thank you very much for allowing this to be lifted. I brought forward this inquiry in line with I believe it was the 2021 annual report presentation where Councillor Kavanaugh at that time was asking some very specific questions about representation on the Ottawa Fire Service. So expanding on previous council's interest, I wanted to ensure that we were following up with the right questions. So there's just a few pieces within the inquiry that I'd like to bring forward for discussion here. Do I have a reverb still? No? Okay, that's just in my ears. Great. So that being said, I do want to commend the Ottawa Fire Services for the work that they're undertaking in outreach. You can see from the responses in the inquiry that you're doing a lot of different job fairs and that you're really putting yourself out there to recruit from people with diverse lived experiences and backgrounds. And so there's a lot of strong effort on the part of senior leadership. So certainly this line of inquiry is not to suggest that there's a lack of interest or a lack of investment in progress here. But I do think there are certain pieces relating to overall corporate goals that are important to discuss at this time. So certainly I wanted to ask about the line in the inquiry response where you said, It was important to note that while this information was voluntary provided during the recruitment process, so this is with respect to the voluntary survey, where people can disclose if they are a member of an equity seeking or equity deserving group, it is not part of the scoring process for interviews and hiring. So could you expand on what that sentence meant and how you are trying to reach a certain goal in line with our corporate targets for representation for our workforce?
Thank you for that question, Chair, through you. I'm joined today by Deputy Chief Louise Heinz-Schmidt, which is responsible for our training, safety, and recruitment. And what I'm going to do is I'll pass it over to Louise to respond to that question.
Thank you, Chief. Through the chair to you, our new recruitment program is designed to put everybody on a level playing field, which in the past we didn't feel was evident in our recruitment process. So we can ask for the information that is not used in terms of, we don't give points for somebody from an equity seeking group. Instead, what we're doing is we're looking at the whole person. And as a result of that, we've seen quite a substantial increase in the number specifically of women. We're now achieving recruit classes 17 to 20%, which based on studies and statistics is about the level you can see, given firefighting is not a career that every woman in 50% of our population would consider. So a lot of our targeted recruitment programs we're doing, Camp Fit, working with Fire Service Women Ontario, our Fire Ventures program, is showing us that more women are now applying. So we're seeing great success in that, and we're seeing the results in who's applying and who is successful in the recruitment process, whereas that was not the case previously.
So if you were to have two candidates that presented equally on all other aspects of merit for the role, but one was presenting from an equity deserving group, how would you evaluate between those two? Would you seek out to create better representation on the force when you had that choice in front of you?
Our target is always to hopefully increase the diversity. We rarely have situations where people are exactly equal. Sometimes their experiences from being a member of an equity seeking group brings them up to a higher level based on the criteria we make our selections. So it kind of happens naturally that way.
So it may appear that it happens naturally, but what concerns me, I believe, is that, you know, we are working within systems that were struck and cultures that were struck for many, many decades within these institutions for which we serve. And so now should I continue, Chair? Yeah, thank you. So that being said, we do require a bit more of a stringent approach to recruitment, retention, that might have to be a bit more explicit versus implicit. So I wanted to understand, you know, the city, I know we talked about it a little bit because we've discussed this inquiry already, but the city's leverage equity to achieve diversity and inclusion targets. The Lead It program includes a comparative merit model. And that is what tracks candidates through all steps of the hiring process, equally compares the competencies and experience of competing candidates, and then articulates a step-by-step process to score and prioritize the hiring of equity designated candidates who rank highest in meeting all competencies. So can you let me know how your recruitment process is aligning with that corporate program?
So how we decide who gets an interview, which is the biggest hurdle for candidates to overcome, we have created a matrix where we have put a series of headings that we believe will make a good candidate. That is how we rank our candidates to get an interview. They score higher in those areas where we're looking for people with experiences, not just about firefighting, it's about who they are as a person, what volunteer capacities they filled, other values and characteristics within them. So that's what I'm saying. We rarely get ties, so to speak. We're rarely faced with situations where we have two candidates who score the exact same. But those experiences from belonging to these groups are going to put them ahead. So it's not a checkbox where, you know, you are a visible minority, so you get an extra point. But what experiences they've gone through as a result of being part of that equity seeking group will automatically give them additional, essentially additional points in the other part of the matrix.
And if I just may add, thanks for that response. This project for this new recruitment revampment started 3 years ago, and we looked at across the nation what are some of the best practices, and we truly believe we have a non-biased, reproducible system now where regardless it's objective versus subjective, and I think a lot of the heavy lifting occurs before the recruitment. It occurs at the ambassador. It occurs where we're in the community working with groups that are underrepresented, and that's where we've seen with women in the fire service right now, where we're seeing a threshold of 17 to 20%. And when you look at the data and the information, that's a threshold that we're very proud of, and we need to maintain that. And I think our focus and our shift, although we need to maintain that, we need to now focus that from an underrepresented group. And I think what we can do and what our goal is to use some of the successes that we've had. Fire Service Women Ontario, you look at Camp Fit, some of those initiatives now where we're focusing on other groups or other segments of our community.
So I do see another committee or another council colleague on the call. So I'll just ask a couple final questions about the content and then defer over. I just wanted to know, you also mentioned that it's still coming. The voluntary survey is still coming to be part of the voluntary recruitment process. And so could you commit at this time that will be done? Because I don't believe that from a resident perspective, there should be much interpretation on HR practices, whether you're a voluntary service member or a career service member.
Yeah, and we absolutely agree with you. So there should be no difference. And we've already made steps to have that implemented as part of our volunteer application process as well.
Okay, fabulous. And also with respect to the representation on your hiring panels, or making sure that the bias of your hiring panels is maintained or managed. When I say bias, I just mean perhaps being more familiar with community members, or, someone knows someone or whatever. It happens everywhere. Having that sort of objective hiring panel, are those pieces that you're committed to as well?
That's always our goal. As I stated, when we looked at our urban recruitment program, there was a lot of amazing learning outcomes, and it's an opportunity for us to apply that on the volunteer side as well. The one item that I want to share that is slightly different on the volunteer side is we have to work within the demographics of that community. On the volunteer side, as we know, we have members that live in the community, and they have to, the ideal response time is to have an apparatus out of the station within 5 minutes. And we talked about that last week or a month ago on our annual report. So we have to take those items into consideration as well, and based on availability of people in their community. But you raise a point that we agree with. There's a lot of elements that we can take from our urban recruitment that we can apply to our volunteer side of things as well.
Okay, great. Thank you. Because I believe that when we got the answer to that piece of the inquiry, it wasn't answering about the hiring panels, but it was answering about the recruitment process. So I appreciate being able to clarify that here. Thank you, Chair.
Thank you, Councillor, for those questions. Councillor King, you are next.
Thank you, Chair. And I'd just like to thank Councillor Johnson for this excellent inquiry, as well as the fire service for their in-depth response. I did have a number of questions concerning the inquiry, and they really revolve around what the Ottawa Fire Service is attempting to do to improve the on-ramping for employment opportunities, especially for diverse communities and especially our youth. In the report, I do see that the OFS attends a number of events, and I'm imagining that the fire service will probably be attending the youth fair that the city is holding in Vanier this evening. So I'm seeing a lot of work that's being done at specific events, along with events at high schools. But I'm also wondering what work does the fire service undertake with our school boards to assist with ongoing exposure to employment opportunities. I'm just wondering if the fire service, as an example, works with the school boards to assist with certification testing, as an example.
Through the chair to you, Councillor, we have a few initiatives we're working on right now. We have a ambassador group with Ottawa Fire Service. These are, it's made up of members of all equity seeking groups within our service. So we have the subject matter experts working on how we can reach out to the community to best attract more candidates to the service. We currently have 2 co-op students in Ottawa Fire from the high school level. This is the first time we've done that. We typically usually go to the college level, but we learned through our experiences with Camp Fit and the success of that program that reaching out to high school students, as you suggest, is the way to go, because that's the age 15 to 19 where they're deciding what they want to do with their lives. So what we're doing now with this ambassador group is looking at the success we've had there. And just for reference, we now have 8 urban full-time firefighters who were campers, which to us is a very big, is a huge success. But given we've been doing that for 14 years, so it's not a quick turnaround. This is a big ship to turn. So we're looking at the success of that program and how can we apply it to all other equity seeking groups. So we also have a ventures program, which is made up quite a diverse group, and it's through Scouts Canada. They come every week and work through all kinds of fire service training. We always go to we have our ambassador group who goes to the job fairs. We go to all various parades. We're trying to get it out there, but you're entirely correct. It's focusing on youth that needs to be our next big step. So that's very high up on my agenda, and something we're definitely working towards.
I appreciate that, because that was going to be one of my other questions. How was Camp Fit being adapted to address more diverse communities, whether we were adapting the programming and the engagement in order to have more youth in the process, because you're absolutely right. I think we can't just expose these youth to opportunities. We also have to support them. Because there are stringent requirements in order to obtain employment in the fire service, and so it's important for us to have ongoing supports. So I'm just wondering if you could outline, and I think you have a bit, but what is the follow-up after youth attends a job fair or there's a school visit? Because I think that's an important component. It can't just be a one-time exposure. I think once you obtain some information from an applicant, there has to be continuous follow-up, and even the potential in a sense of mentoring to get that youth to a place where they would be able to have a successful application to the fire service. So I'm just wondering what type of follow-up work is done with our youth.
Councillor, thanks for that question, Chair, through you. As part of our ambassador group, and you highlighted it in part of your question, is that it's that mentorship afterwards. So it's fine that we're in the community, we're reaching out, we're trying to bridge those gaps and finding where we can help. It's really that mentorship afterwards where we have our ambassador groups where they can reach out, and that's where our follow-up is involved, where our staff will reach out to these members to see how they're doing, we may start down the path of fire service and it may find them a different career path, and we've often found that as part of our Camp Fit program. So it's really our ambassadors that we have embedded in our community that are our mentorships moving forward for these members.
And the last question I have is obviously the list that you have around career fairs and engagement with equity seeking groups is not static. So I'm just wondering what measures are you taking to expand that list? I think of organizations such as Youth Ottawa that are working on developing educational programs, nutritional programs, recreational programs. And I think that they would be a great fit with working with the fire service in terms of the recreational programs that they're undertaking with both boys and girls, youth, to really expose kids who are in physical training programs to the fire service. I think that would actually be a great synergy. So I'm just curious, how do you go about expanding the number of working organizations that you deal with in terms of groups seeking equity in employment?
So that's a good question. There's a lot of our ambassador members who belong to some of these groups on their own volition. They volunteer their own time outside of their work, even with the ambassador group. So we have some really good connections that way. We're looking at a new program right now to help get some people through who have financial barriers for the certification process, which is very stringent with our new provincial legislation for mandatory certification. So we're looking at a new program to see if we can help offset some of that financial difficulty for them. And this is the type of these are the types of groups we need to hit to see. We need to find the right candidates to get them through this process. That's something that I have one of my ambassador members who is this is a project near and dear to his heart. So we are actively working very hard on that right now. And our goal is that we will be able to introduce this career to someone who never felt they could achieve it because of the barriers that they're currently facing. So, and I think we're pretty far down the path of having a plan to make this work. So we're going to be running a pilot project, we hope, for 2024 to get a few members through. And the goal is to have them join our service and without any financial barriers.
That's excellent. That's the right trajectory. I know I've been having other discussions with different agencies throughout the city to adopt that type of model to provide not just the educational support and the information to the youth, but also financial support if necessary in order to, especially if an excellent candidate is identified, to ensure that they have an excellent chance at employment. So I think that the direction is right, and it's my hope that we continue to have oversight like this that emerged from Councillor Johnson's inquiry around the progress that we are making in terms of hiring more women and more diverse members from more diverse communities. So I really thank you for this report. I thank once again Councillor Johnson for the inquiry, and thank you for the time this morning, Chair.
Thank you, Councillor. Before I recognize Councillor Johnson again, just for our colleagues who have just recently joined us, our agenda at the moment is on item 4. We've pulled the response to the inquiry with respect to equity, diversity, and inclusion in the Ottawa Fire Services. So that's where we are at this time. Since Councillor Johnson has spoke already, does anyone else want to jump in now before I recognize Councillor Johnson? Seeing no hands, Councillor Johnson.
Thank you for the indulgence of the committee to ask just some further questions, because I do believe this is again, of interest at a corporate level. So, you know, we are talking about being able to demonstrate the progress of the service over time, which leads me to wonder to what extent and where we capture the data relevant to this type of work. So does the fire service hold data collection within the service, or is this something that's managed through the EDI office at the City of Ottawa? And how do the two relate?
Thank you, Councillor. Yes, no, that is managed through the EDI office through the city, so the main HR department.
So if we were to ask, you know, because I think I did ask when we were sort of going over this inquiry ahead of time, to what are your retention rates for women and for persons with visible disabilities or minorities? I don't think we had an answer at that time. So do we have an answer now, or is this something that we would then have to ask at a higher level? How does that work?
Yeah, thank you for that question. This is information that's part of the corporate, but I can certainly tell you from a fire service, I don't have the data sitting in front of me today, but I can certainly tell you from a retention, there are very few firefighters that resign or, terminate their employment with the fire service. So once they become a fire service member, we often see members for, 30 years, 25, 30 years of service. So it's the retention rate is very high that we retain our members.
Okay, thank you for that. Because I do believe, from a corporate standpoint, when it comes to issues of inclusion, that we do need to have some robust understanding of retention across the corporation. If you're not feeling supported as a person with, a various lived experience or perspective, you may go on long-term disability, you may go on stress leave, and these are very costly consequences for the corporation. And we actually are hearing a lot about them in various departments, not just fire services, but other departments as well. And certainly we don't want to imagine that by recruiting people with diverse lived experience, it affects the performance of a department. I think we've moved a long way. But ultimately, even if we advance our recruitment, our outreach, we still need to keep them. These are really good jobs. If you go to if you talk about it, fire service jobs are great jobs because there's a lot of things that are really valuable about the culture that you provide and the benefits and the opportunities. And we want to make sure that everyone in the city has access to great city jobs in the fire service and elsewhere, and that they can succeed over time, because that diverse perspective enriches our support as a public service. And I know you know this, and that we know this. But I do sort of signal to my council colleagues that I'm going to be further interrogating the data on this at a corporate level to understand how we report out and how we measure this progress over time. Because if 1 in 5 Ottawans are going to be of a visible minority by 2031, that's just around the corner. And so that 20% goal that we have at a corporate level that fire works with for the female firefighters, it needs to be applied for all backgrounds. For us to be able to say, yes, you can see yourself in this service, which is something that I borrowed from our meeting last week. So I appreciate the time on this. And if anyone else wants to continue working on this with me, we do need to engage with this history and look to a better future on these targets. So thank you.
Thank you, Councillor Johnson, for your questions and for your interest in this matter as well. Thank you. Okay, seeing no other hands on this item, we will move along. We have already dealt with item 5 on our agenda. Item 6 is in-camera items. There are no in-camera items. Item 7, information previously distributed. This is regarding the safe alternative transportation pilot. I have asked staff to come prepared to the meeting today to provide the committee with more information about this pilot. I think in the interest of transparency with the public, we should have greater awareness of what's being proposed with this pilot. So I do need the support of colleagues to allow this to come on our agenda for further discussion. Do I have the support, 2/3 support of committee members for this item? Okay, thank you. So I'm going to ask both the general manager and our chief of the paramedic services to come forward and just provide a brief overview of this pilot that's about to commence. Good to see you this morning, both of you. Thank you. And I guess General Manager Ayat, so we'll start with you.
Thank you, Chair. Yeah, this is it's an exciting time. Obviously, our healthcare system is in I guess you could say dire straits. We're struggling with the healthcare system, and the paramedic service plays an extremely important role in the healthcare system. And one of our biggest challenges that we're facing right now is offload delays at the hospitals, and we're doing absolutely everything we can to try and minimize the impact of offload delays. What this program will do, and Pierre will get, or Chief Poirier will get into more details, it offers us an opportunity to deal with the lower acuity calls. And those are the ones that don't always need an ambulance, but they call for an ambulance. And so once our paramedics arrive on scene and they assess the need and they go through a process, many times we are required to transport them to hospital, regardless of the acuity level. And when they get to hospital, the emergency departments will actually, triage them and put them at the bottom of the list for care, which means that paramedic unit could be much longer than 2, could be 3, 4, 5, 6, 12 hours in the hospital with a patient that really doesn't need that level of care. So based on that, we've been looking at all kinds of options. This is not new. It's actually happening in other jurisdictions, this program. And I'll now pass it on to the chief to actually explain it in better terms than I could. Thank you.
Thank you, General Manager Ayat. Thank you, Chair, for the opportunity to speak to this. Truly the fact that the healthcare system in crisis is not, I would say, in dispute. And what's happened with healthcare is that it's backed up to the paramedic service. And we've been having to deal with the consequence of lack of family physicians, lack of hospital beds, surgical backlog, lack of nurses, and the list goes on. And the sum of those items prevent the emergency rooms from decanting or moving their patients through, either to a bed in the hospital or to a definitive care or definitive diagnostics. And currently, in the notes, a couple of items, level zeros continue to, I'd say, affect our community. There's been over 1,000 events, and those 1,000 events are over 30,000 minutes at this point, 500 hours, the equivalent of maybe 22 days of level zero, where we're not providing the service that our community expects us to. Further to that, the hospital offload times, the 90th percentile is over 2.5 hours. So you put those two items together and there is a significant problem in our community, and that really requires us to look for creative ways to, I'm not saying solve the problem, but help mitigate and deal with the issues that are presented to us. General Manager Ayotte mentioned that this is not unique to Ottawa, but it is, in terms of its application, is unique to Ottawa. Currently in Niagara region, they're providing this service through their communication center, where there's an assessment done by the phone, and the individual is then had a taxi sent to their residence. We're taking a little bit different approach. Our approach is that we want to be incredibly safe in terms of how we do this, deliberate, and I'll get through the actual process by what we intend to do. Just one more kind of fact to add to this is about 20% of the transports we do are low acuity, which would be the CTAS 4 and 5s. So those are individuals who may have a twisted ankle, may not be feeling well with no other complaints, may require stitches for a cut. Those individuals are 20% of the people we transport. Put it in context again, we transport about 250 patients to the hospital every day. So the quick math there is 40, 50 individuals who may qualify. The program that we're envisioning right now is looking at maybe 3 to 5 of those individuals, where we're going to be able to say this is super safe. And how we create that safety is that the process is the paramedic crew will arrive at the patient's side, do a full assessment. They'll categorize this patient as being very low acuity. Could be a CTAS 4, CTAS 5. They then consult with a physician, have a conversation and say, what I see, do you see that as well in terms of what I'm describing to you? Thereafter, they'll make a determination that either there's a couple options. One is we cancel and provide no further service, or take you to the hospital, or, and this is where we're adding the third option, is where the paramedic may not be needed to provide additional care, that we will provide a service by which a taxi will come to your residence and transport you to the hospital, or, and where I'd love to get to, bit by bit, would be to an alternate destination. Part of the healthcare system being in such turmoil is that, and credit to the Ministry of Health and different innovative approaches, you're seeing right now pharmacists are allowed to prescribe. They're allowed to do much more. So could it be in the future that somebody has a urinary tract infection? It's not life-threatening, but it's something that may require treatment. Could that individual be then transported via taxi to a pharmacist to provide their prescription, to provide the definitive treatment? And this is all kind of laying the groundwork for us to do bit by bit, build capacity within the system. So for us, it's very important that if we don't transport somebody to the hospital, recognizing that these are the lower acuity patients, that we may be saving 2, 3, 5 hours of offload time, which is incredible. But it also allows that paramedic crew to be available in the community to do the next call. So that's why this is such an important initiative. It really is something that'll help. And bit by bit, we hope to expand it, to figure out ways that we can do this, continue to do it safely. And there's 2 principles here. One is we can do this safely to provide the treatment. We can also give the patient an option. which is not just cancel or we'll take you to the hospital, cancel, we'll take you to the hospital, or we'll actually access a third service, which could be a taxi. Thank you for the opportunity, Chair.
Thank you, Chief, for further explaining this. We appreciate that. Any questions from members of the committee? Councillor Devine?
Thank you, Chair. Chief, thanks for presenting on this. I just have a few questions. So I'm generally supportive of the program and any of the innovations that you're bringing forward to try to address the challenges that the city's facing. Just a few technical questions to help me understand this. So one thing you described there is obviously this solves the issue of paramedics having to wait through what could be a lengthy transfer. So I'm assuming that if the patient goes with the option of taking the taxi ride to the hospital, I assume the taxi driver does not have to wait through a lengthy transfer.
That is correct.
So can I understand then, if the taxi driver does not have to wait through a lengthy transfer for a low acuity incident like a sprained ankle, in those instances, why then would the paramedic have to wait through a lengthy transfer in the first place?
Good question, Chair. Through the councillor. There are occasions, and sorry, maybe just directly to the specific part. The taxi driver would drop that person off at the door, and the person would be able to walk into and go to reception. When paramedics do that, there are occasions where we go to triage and they ask us to wait. And simply there's a different treatment of the paramedic crew than there may be of somebody just walking in the door. So the reason that the population that we're talking about is not all 50 every day is there's a specific population that we may choose that don't require the ambulance to transport us, and they can walk in the door, but we don't have that privilege in the same way. We're not there yet. Through COVID, they restricted the ability of paramedics to drop people off at the other door. We go in a separate door, and that door requires us to go through triage, where we're actually have a different evaluation than if somebody just walks in. So it's no different than right now. If I put it in the extreme, if somebody walks in with chest pain, they walk in that door. But if somebody comes with us with chest pain, we walk in the other door, and our assessment will be different.
Just to help me understand this, because so a paramedic is not permitted. Let's say the paramedic has somebody in their ambulance that has a sprained ankle. The patient wanted to go to hospital. The paramedic is not permitted to just drop the patient off as a taxi driver would at the front door. That's just not the way we're allowed to go about it.
Correct. That's a different, actually, I have that as an initiative to change that process as well. And I'm in discussion with the hospitals right now on that process.
All right.
Yes.
Thank you. Do taxi drivers require any specific training for this?
Good question, Chair. We're currently in the contract negotiation specific to how this would all work. And we're using the template that the Transportation Services has in their contract that they've had with a taxi service, where it was about a, I don't know, 15, 20-page document with the detail about all of the criteria of how this would work, and also the specific training that the taxi drivers would require, and ensuring that all the issues related to the rules and regulations around the taxis is applied. So yes, we would be reviewing all of that, and that is part of our legal review at this time.
You were mentioning that when the paramedic arrives on site, they would do an assessment and see if it's low enough acuity to use the taxi service. I'm sure that there are instances where a patient during the ride in the ambulance, things escalate, things go wrong. Can I assume that no paramedic would make the call to put a patient in a taxi in any kind of situation where there could be volatility during that ride?
That is correct. And that is part of the consultation with the physician to ensure that we're doing this safely, to appreciate the nuance of the clinical presentation of a patient. Yes.
Last question. You mentioned consultation with the physician. Is that a new element that is being used as part of this pilot? Or normally, when a paramedic arrives at an incident, they have to consult with the physician generally? Or is this consultation with the physician purely as one of the checkboxes to permit the use of this pilot?
The paramedic always has the discretion to consult with a physician. But to this program, this is something, an added layer that we've added. So in situations where there's a patient that is a very difficult clinical presentation, paramedics will do a consultation with a physician to provide additional guidance on how to treat that patient. This is a little bit different where where the paramedic will be confirming that their belief that somebody is a low acuity patient is being able to be confirmed through that consultation, that discussion with the physician.
And those physicians would be available for those consultations? Like these are, a quick sudden phone call. Would there be somebody available for that consultation?
That's correct.
All right. Thank you, Chair.
Thank you, Councillor. Councillor Johnson, you're next.
Thank you for the presentation, and I was very excited when we did the tour with your service back in the fall that you were considering some of these options and trying to be as creative as possible. You always look like you need a big hug, so I'm glad to hear that you're trying to think about, what can ease you and your services load. I wonder for the taxis again, because of course my heart is in my throat a little bit on taxi stuff. Are we expecting that the resident would pay for that taxi from the house to the hospital?
Through the chair, no. The answer currently is that the expectation is the Ottawa Paramedic Service would absorb that within its operating budget.
Okay, so you imagine right now that you have, at least for this pilot idea, a buffer to be able to absorb the cost of it.
Yes, correct. Through the chair, our expectation is that the taxi cost would be less than $40 a trip on average. And the cost avoidance for the Ottawa Paramedic Service per call, using the broad number of a 2-hour offload, is $200. So the net savings from a cost avoidance is going to be $150. And that's very conservative because I'm not including the costs of the vehicle, the fuel, all the other ancillary costs that may be associated with it.
Okay, well, that sounds very exciting. Do you have a sense of, I mean, I guess it could be any kind of person that ends up using this service, but for these low acuity calls, are there any trends as to whether or not they would require an accessible taxi?
Thank you, Chair. The answer is yes, and that is part of our discussions with the taxi service, that will be a requirement, that the accessible service will be available.